Hi, this is Dr. Sigmund with Core Chiropractic, and I'm here today to talk about disc anatomy 101. So the discs are the big shock absorber pads that are between the bones in the spine. So you have the vertebrae, or these white bones here. The discs, these big, gel-like looking things between the bones here. These yellow things here, they're the nerves. Now, we need to make sure these discs are big and healthy. The bigger they are, the more space you have for the nerves coming up from your spine. Now, the discs are made up of two parts. So if you can see here, it's almost like a jelly donut. So you have the outside layer, it's called the annulus fibrosus. Inside layer is like a jelly, gel kind of like substance. It's called the nucleus pulposus. Has very sensitive material in there that can leak out over time and cause irritation to the nerves or pressure. Now, the thing is, these discs over time, they get squished down, they get squeezed, and then they don't look nearly as healthy as they do in this model right here. Over time, what can happen is they can start to kind of pull over the edges, and they cause what they call a disc bulge, which means those fibers are essentially extending over and they're causing pressure that can be onto that nerve. Now, that annulus, the outside, the thing is over time, those fibers can tear. When they tear, they don't cause just a bulge, but they can actually cause a herniation. And the herniation means when that inside material that gets really red and really angry, gets inflamed, will start to leak out and cause pressure onto that nerve. Now, herniations can be tough because over time they can do what they call protrusion, which means they almost like balloon out. And so you see here, that disc will balloon out and cause pressure onto that nerve, which can be a herniation, protrusion, and even sometimes it can happen, it can do what they call an extrusion, which means that material inside that disc, which they call that nucleus pulposus right there, can start to actually leak out and into the spinal canal, goes onto the nerves, and that's a bad way to go. So that's the difference between a herniation, bulge, protrusion. I'm getting very technical here with these terms, but the main thing is the bulge is the thing that happens all the time to where that disc peels over the edges, and then the herniation is when the inside that jelly starts to leak out, and then that's when bad things start to happen. Now, there's ways that you can go about it as far as getting the discs themselves to go back to where they're supposed to go, okay, and essentially be in line with the spine. So the main thing you can really do is get adjusted. So making sure that those areas of the spine are not in a bad position. They're not tilting, they're not twisting, creating more pressure onto those discs that can affect the nerves and create essentially the bulge herniation, and it can just get worse from there. So the main thing is really getting adjusted to make sure we get the pressure off that part of the disc as much as we can. And that's done with a very thorough exam, making sure you take proper x-rays and you get adjusted properly, obviously based on what you see on the x-ray. And there are also different therapies that we do offer here at Core Chiropractic. Now, the first one really is the disc, is the decompression. So that allows us to essentially stretch that spine in order to make sure that we get as much blood flow into that space as possible. It's a nice, gentle stretch of that spine on our machine called the backbone track. There's other machines that are out there that can do this, mimic the same maneuver. But the main thing is really just stretching that spine in order to get that blood flow into that space to give you more of that cushion. More of that cushion allows more shock to be absorbed for your spine, less chances of you having a bulge, herniation, or anything that could be potentially worse. Sometimes if the bulges are too bad, they are herniating and they're a little bit more significant, a little bit too big, is we can do something like called PEMF or even height therapy. Now, this allows us to essentially deliver a deep pulsing magnetic sensation into the body to essentially alleviate swelling, inflammation, fatigue, a lot of the muscle spasms, things that hold on to those parts of the spine really, really hard, and they don't allow that disc to let go. So those therapies are really effective. They're very easy to use. They're minimal requirements to the patients as far as positioning. They just have to lay there and they just let the machine do the work. So, that's what we offer for our patients here at Core Chiropractic is we help out the disc issues. Depending upon we meet you where you're at, whether we start with the PEMF, the decompression, we do height therapy. But the main thing is that we always meet you where you're at, and then we go based on what we find on our x-rays and our exams to give you the most relief on that disc as possible. So if that's something that's for you, make sure you give us a call and check us out here at Core Chiropractic in Memorial City, or in the Galleria area, or even Greenway, and we're more than happy to help. I hope you all have a great day, and we hope to see you all soon.